Have you been prescribed Metformin? And I'm sure there's lots of questions attached to that prescription as well. Here's why, some reasons. First things first, if the Metformin is prescribed for a non-diabetic person, common cause is polycystic ovarian syndrome. And if you've been diagnosed with it, this is what we prescribe. And definitely there's lots and lots of videos, opinions and advice floating around. Okay, should we take it? Should we not take it? Is it really important? It's a diabetic medication or anti-diabetic medication. Why should we take it? As per usual, polycystic ovarian syndrome, I'm sure you've heard of this, what is the presentation and what happens. And if not, please watch our video. But basics have to be covered again and again. I'm going to emphasize the same thing: eating healthy, exercising, and consistency in maintaining these two is really important. Only then, whatever next step that you take will really help change what's ahead for you. Otherwise, unfortunately, even if you fall pregnant with or without assistance, we end up producing a generation of diabetic babies. That's not what you really want. Metformin acts in 3 different ways, and it's important you realize why you have been prescribed. So the first way that can act is it decreases the liver production of glucose. The second way it can act is that it decreases the absorption of glucose from the intestine. And the third way it acts is by increasing the peripheral sensitization of the cells to the glucose, which means basically the cells can uptake the glucose, metabolize it, rather than keeping it inside the bloodstream and increasing the blood glucose levels. So why is it that a PCOS woman needs to be on metformin? Couple of things. If you have listened to the previous videos of PCOS, you know that PCOS is a condition where insulin is increased, or the insulin resistance is increased. So to reduce that resistance, metformin helps. So this indirectly can also help with weight management to the person who has been prescribed metformin. Now definitely this has to be done in conjunction with your advice from the healthcare provider, but it is advisable if you have been prescribed, continue to take it. Remember, consistency is important. Yes, there are some side effects like nausea, vomiting, diarrhea, tummy upsets, but please speak to your healthcare provider if this is something that you do experience. Now, generally, these are short-term medications that we prescribe until we achieve a goal of either weight loss or regulation in your period cycle, or until you need reproductive assistance, or until you fall pregnant. The dosage, start with the minimal dosage because we want your body to acclimatize to the medication. But again, if there's any side effects that you're experiencing, I would say please speak to your own healthcare provider. I just want you to alert to the fact that we have already created a polycystic ovary syndrome video. So if you haven't watched it, I would recommend that you watch that video first. And then if you watch this, you'll understand why the importance of metformin is, so that the pathophysiology is explained in that video. So if you would like to subscribe to www.athenawomensclinic.com.au and enhance your own knowledge as well. If you would like to educate yourself a little bit more, then you can subscribe to our YouTube channel and educate yourself.